Those small children, yes.
Hello, good morning and welcome. My name is Omodan Isibo. I'm the Training and Service Manager, Moricol Healthcare Services Limited. And today we are continuing our series of free trainings for health professionals and professionals who are interested in doing, gaining more knowledge for practice and for their home use. Okay, so we'll continue from where we stopped. Today we are having introduction to first aid. So we are going to talk about first aid. You know, first aid is a useful skill in the office. It's a useful skill in homes. It's a useful skill in different facets of life. So it's not just for health professionals. The information is key for use in different areas. Okay, so before we start, just like tradition, I'll do a quick recap on who we are and what we do and how we can be of service to everyone. We have something for everyone. There's nobody in any part of this country or even outside of the country that would not have a service that can touch their lives. So we at Moricol Healthcare Services Limited, we are a service provider, health service provider using cutting-edge technology to provide these services to help improve communities, both health-wise and economically. Okay, so what are the services we render? We provide home care service. So you have loved ones, you have vulnerable ones, you have the aged that you want to reach out to and you want to keep healthy, both in their thoughts and in their physical body. Reach out to us, we provide our service. We are able to reach out to all our clients in any part of the country. We also have massage therapy service. We collaborate with hotels, we collaborate with other institutions to be able to provide this cutting edge service. So irrespective of where you are, you can have a massage service to suit your need, both medical need and both for cosmetic needs. Okay, so we also have pharmacy. The pharmacy also houses our organic products. We advise people about using organic products free from chemicals to boost their immune system to improve their health outcomes. So this pharmacy can provide for everyone irrespective of their location. So we have it both online and in store. Then we have training service, just like we are having now. So aside the free trainings, we do have other service training courses that are useful for people, especially people who are planning on traveling out of the country. So for healthcare professionals, for soft skills, for blue collar skills. We have that on our website and we are able to provide that service remotely. So irrespective of your location, we are able to give you trainings that speak to your needs. And these trainings are certified by our partners in the UK, a CPD provider. So our trainings are CPD certified. Yes. So these pre-trainings that we are running, the series that we are running. So for the number of trainings that you decide to engage us on, we are happy to have you on board. The training is free. However, the certificate you'll be getting, the certificate of achievement you'll be getting, you'll pay a token of 5,000 naira for it. Exciting, right? It's almost free. Okay, so so we have these trainings. You want to travel out of the country and you need the requisite training, the requisite knowledge, the skill to be able to cope out there and to be able to present a certificate that you can use to work. We are able to provide that service for you. So reach out to us on 0911 831 4047 and we'll be happy to guide you. Yes, going on, we do recruitment. Yes, we are a certified, we are an accredited institution to provide recruitment service locally and internationally. Okay, so these services are certified, are licensed by the Ministry of Labor, and so we are able to provide labor to local communities, local companies, and then outside of the country. So reach out to us in case you want to know more information about it. We'll be happy to let you know. And then we provide coaching service for corporate executives. A lot of people these days don't have time, so they need to learn skills in order to learn, prevent diseases, keep a healthy lifestyle, keep their lifestyles balanced, work and life balance. We create that coaching opportunity through in office or in on-site trainings. We also organize retreats for these companies, both locally and internationally. So there are a wide array of things that we are able to achieve, both with the corporate organizations and individuals. And then lastly, we are into medical loan service. So we provide loan services to people who are working out, who may have some fund emergencies to settle their medical bills. So we are able to provide that service both in the short term and in the midterm period. So they are able to settle their medical bills and then have a more organized life. So Moricol Healthcare Services is a household service company to see to the improvement of to the communities, individuals in the communities, and the economy of the country generally. We are also into collaboration with the government to bring these things to people in the community. And most recent times, we provided a program for youth development, which is to help youth improve their economic outcomes and to see to how they can improve their enterprises and through funding and then through partnerships from the UK. So hopefully we are able to expand on that and then create more batches for such entrepreneurship advancement programs outside of the country, all to help improve the economy of the country. Okay, fantastic. So let's go straight to the business of the day. So today we are going to learn more about first aid, what first aid is about, how to attend to casualty, what are the things expected of a first aider, being a first aider, what should you look out for, how should you respond. These are things that you should learn. So it's not just for people within the health sector. It's open to people in schools, people in the offices, as long as you are in an environment that is vulnerable to accidents, you are expected to learn how to provide first aid. So even children are being taught about first aid now, because there are times that in a time of emergency, they only have themselves, and so they need to be able to respond quickly. Okay, so prompt response to emergencies help to alleviate or improve the outcome of a casualty, so they stand a better chance of surviving. Okay, so I'll be sharing my slides. Mm, okay. So we'll be learning about first aid. We'll also learn about what Dr. ABCD is. We'll be looking at roles and responsibilities of a first aider. We'll be looking at the aims of first aid, incidents management, uh, common injuries, and the like. Then we'll look at incidents management. Just a minute, please. Okay, incidents management. We'll be looking at common injuries. We'll be looking at cuts. Under common injuries, we'll be looking at cuts and bruises, sprain and strain, electric shock, fire and burns, fainting, unconsciousness and shock. Then lastly, we'll be looking at choking in adults or adolescents, children, and babies. We would also look at how you can call for help in an emergency. We'll take some exercises. We'll do a video recap of everything we have learned and more. Then we conclude, we ask questions, and we do our final thank yous. Okay, so quickly, let's go straight into the business of today. Let's do a quick exercise. So take a look at this picture. Take a careful look at it. Let's see. Take a careful look at it. look around. What do you think has happened here? Now think about the photo in the previous slide. Take a few minutes to discuss how you would manage this incident. I want to have an understanding of what you think or what you're thinking when you see an accident. Okay, so how would you manage this accident? What injuries will the casualties present or could be present? What should your first action be? What should your first action be? So take 2 minutes, quickly do that. Send your answer to 0911 831 4047. I'll take that again. Take a quick look at this picture. Take a quick look at it. You can even snap with your phone or screenshot. Take a quick look at it and then answer this question. How would you manage this incident? What injuries will the casualties present or could be present? What should your first action be? So send your short response to 0911 831 4047. So in 2 minutes, we try and do that in 2 minutes. I'll be going between the two slides. Send your response to 0911 831 4047. 0911 831 4047. Okay, moving on. What is first aid? So first aid is the help given to a sick or injured person until full medical treatment is available. Some other house of thought will say provision of initial care for an illness or injury. Some others will say the immediate skilled help given to a sick or an injured person before the arrival of professional medical team or medical care. Okay, so what is key here is that first aid is what you provide before the arrival of skilled medical care. So you need to provide it immediately. So it's not something that you have to go and get in some specialist equipment. Or it's a skill. It's a skill you need to provide at the point of getting to the injured person or the sick person. Now, there are basic things we need to be aware of when you are providing first aid. So in all situations you find yourself, you need to always first assess your situation using the doctor's ABC. Okay? Using the doctor's ABC, you need to be able to assess the situation and you know how to respond to it. So in every situation you find yourself, always look out for danger first. Now, do not put yourself at risk because you are trying to provide help. No. You need to assess the situation first before you go into it, because the risk you put yourself into, you are not just putting yourself into such a risk, you are putting the other people who are depending on your skills also at risk. A first aider serves a minimum of 5 to 20 casualties per time. And so should you be putting yourself in danger, you are not just putting yourself in danger, you are putting a minimum of 5 to 20 other people in danger. So you need to assess your scene, assess the situation before you venture. And that should be done within less than a minute. So remember, time is key in rescuing people. So do not waste so much time perambulating around the scene because you want to assess for danger. So you quickly take a look, see how it is, then you proceed. The next thing to do is to respond. So after assessing the situation, you respond to the situation. So you respond by approaching the casualty. Try to speak out for the casualty to respond. So in responding, you are able to assess the situation that the casualty is in. So you are able to know whether the casualty is responsive or non-responsive. Okay? The next thing, as you approach the casualty, as soon as you get to the casualty, do not act in isolation. Try to call for help. So even when you are in the midst of a crowd, do not act in isolation. Assign someone to call for help. You call 999. Try and reach the road safety people. Mr. Man, try and get ambulance around. So do not act in isolation. Assign help if you have other people around. If you are alone, pick up your phone and call an emergency number. Now, the remaining acronyms, ABC, is key to know what to do next after calling for help. So it's important that a person's airway is clear to be able to administer first aid. So like I mentioned earlier, as you approach a casualty, try to call out and see if the casualty is able to respond. Okay, so now for a casualty who is not responding, you try to find out if the airway is clear. So if there's anything tight around the neck or around the waist, try and loosen them up in order to create free passage. Okay, so another way to know if try and create a free passage, let the airway, the air part be free. Try not to remove. Please mute yourself. You are distracting the class. Please, when you enter into the class, keep your microphones muted. Thank you. Now, another thing you should be aware of, try not to remove clothing. You can loosen up, but do not remove, especially in situations whereby you are alone with the casualty. So even when the casualty is the same sex with you, try not to remove, because there are times when a casualty recovers and then they can start having ideas. So try not to remove so they don't think or start having ideas that something may have happened to them. Okay, so losing, do not remove. Now, check for breathing. How do you check for breathing as a novice? Maybe you are not a medical practitioner. Okay, so there are two ways. There are two main ways. First, you take your finger and put at the nostril area. Just take it to and fro. There is always this warmth that touches the finger when the person is breathing. Okay, that's one. Then number two, check for the up and down movement of the chest. Check for the up and down movement of the chest. I'm sure you've seen in movies, especially Nigerian movies, and then you'll be watching, this person said he has died. And then at some point, the person is almost losing the breath, and you see the chest going up and down. So that's to show that there's still life. The breathing is still going on. The person might be unconscious, but he's still breathing. Okay, so those are two ways that you can check for breathing as a novice. However, as a medical practitioner, you know where to check for a pulse just below the ear, the below the thumb area, just at the wrist. And then the disadvantage of advising novice to use this process to check for breathing is because you might be feeling, in an emergency, you might be feeling your own pulse. Because at your own pulse, okay? So that's why we discourage novice from checking pulse at the pressure points, okay? Now, after checking for breathing, should the person not be responsive and person is not breathing, the next thing to do is carry out CPR. Immediately carry out cardiopulmonary resuscitation. Okay? Now, I always ask this question. You are presented with a casualty, okay? Let's jump the preliminaries of checking for danger, response, and for help. Straight up, you see blood around the casualty, and then outside that, you are like, okay, this is the casualty. There's so much blood around. What should you do first? Some people will say, oh, the blood is messy. I'll try and ensure that the person stops bleeding, because if the bleeding continues, you might die. Say fantastic. Okay, so between bleeding and breathing, which comes first in an emergency? Send me your answer. Send it to 0911-831-4047. In an emergency, which should you attend to first? Bleeding or breathing? Bleeding or breathing? Send your answer to 0911-831-4047. Which will you attend to first? I have a student in class, so I'll be communicating with my students in between. Which would you attend to first? Bleeding or breathing? Bleeding. Why? Okay.
First of all, I rest and it doesn't take so much stress to arrest. You just something, apply pressure on that area.
Okay. Okay, so I'll attend to this exercise. I'll answer this exercise now before we move to the next slide. Okay, so a casualty in a pool of blood, not breathing, and a pool of blood. Okay, so now there's something in the order of emergency rescue. Breathing comes before bleeding. Why? Because now if you see blood around, the person is unconscious and likely not breathing, that bleeding is no longer active, because you need an active heart to pump blood for blood to go out of injuries. So if the heart is actively not, and the person is not actively not breathing, that bleeding is subdued. So that blood may have been when the person was conscious and breathing. So at the point of unconsciousness, that bleeding could have reduced. So the first thing is to get the person breathing, resuscitate the person first, and then immediately you attend to the bleeding. Or if you are more than one, you can do it simultaneously. And sometimes if the wound is actively not bleeding, it may have clotted. So in an emergency, breathing comes first before bleeding. Okay, so that was an interesting exercise, right? Okay, so now let's move to the roles and responsibilities of a first aider. What are the roles? What are the things a first aider is expected to do? Number one, manage the incident and ensure the continuing safety of themselves. Yourself first. We are not saying as a first aider you should be selfish, but I have mentioned that you need to be alive and active for 5 to 20 other persons to be alive and active. Okay, somebody asked, what's the full meaning of CPR? CPR is cardiopulmonary resuscitation. Cardiopulmonary resuscitation. So it's a technique to help get somebody who is not responsive, who is not breathing, to be able to breathe again. So in the process of carrying out cardiopulmonary resuscitation, you are helping to support the heart pumping blood and then the brain receiving oxygen. Because once the brain is deprived of oxygen for up to 5 minutes, that brain can go brain dead. Which means even when the person recovers, the person might be in a coma or a vegetative state. Okay, so that's why it's important that CPR is administered as soon as possible. And then the process of carrying out CPR requires timing, because time is key in rescuing lives. Okay, so let's go back to the roles and responsibilities of the first aider. Number one, manage the incident and ensure the continuing safety of individuals, bystanders, patients, casualties, and all. Now, as a novice, as a first aider, you are not expected to call the injured or the sick a patient. That's a term for medical practitioners. So as a first aider, you use the word casualty. Okay? There are other words, but most suitably is casualty. The most suitable one is casualty. So 2, assess victims and find out the nature and cause of their injuries. Assess victims and find out the nature and cause of their injuries. Next, arrange for further medical help or other emergency services to attend to the casualty. If trained, prioritize casualties based upon medical needs. So, like I mentioned before, you prioritize, it's usually breathing over bleeding. Okay? So if trained, prioritize casualties based on their medical need. Then provide appropriate first aid treatment as trained. Now, in an emergency situation, should you not have your first aid equipment, because you are trained, you are able to improvise. So that's why training is key in providing skilled help in an emergency. So it's an immediate skilled help provided to an injured person or a sick person, pending when medical help arrives. Okay? If able to, make notes, observation of casualties, because it's important for you to be able to communicate these to the medical team when they arrive or when you get to the hospital. Okay, Now, fill out any paperwork as required. That is something a lot of people shy away from. I don't want to sign up. I don't want to write. Let them not come and implicate me. No, it is not an implication. It is a case of let's helping them with necessary information to provide the right care. Then provide a handover when further medical help arrives. This is very important. Should you be carrying out CPR, as soon as the first responders or nurses of a doctor comes to that scene, you immediately hand over and step aside. You don't continue. As soon as a more experienced person introduces himself, hi, hello, I am so, I'm a first responder. Oh, what is the situation? You take a step back and say, take over. Immediately you hand over. And as soon as you do that, take your hands up, take a step back, stand by. Okay, so do not keep, no, this is my casualty. It's not a competition. Okay, you have done very well providing the immediate care. However, you are expected to hand over as soon as a skilled personnel arrives at the scene. Okay, so what are the aims of first aid? Broadly, there are three main aims when administering first aid. Number one, to preserve life. Yes, that's number one aim. Number two, prevent worsening of the condition if possible. And then number three, promote recovery. So you preserve life, prevent worsening of the condition, promote recovery. So how is this achieved? It's quite simple. As soon as you intervene in the situation, you are helping to preserve life. And how are you helping to preserve life? First, you are preserving the life of the first aider by checking for danger. Number two, you are helping to preserve the life of the casualty by checking for response and all that and calling for help. Prevent worsening of the condition. Okay, should you meet the person, he's breathing but bleeding? The person is breathing, the person is able to respond to you but bleeding. So you take care of the cuts and wounds. By so doing, you are helping to prevent worsening of the condition. Now, promote recovery. Okay, as a result of the blood loss, the person goes into shock. So what do? You put the person in recovery position. You put the person you put the person in shock position. By so doing, the person is able to recover from the shock. Okay. Now, when you are preventing worsening of the condition, do not make the error of giving things orally. In a critical condition, in accident situations, some casualties will say, give me water, give me water. Please do not do that. By so doing, if you give water, you are reducing that person's chance of getting surgery or any other internal intervention should the need arise. Because it's expected that there should not be anything in the stomach at least 6 to 12 hours before the situation. Okay, so we would let you know what recovery position is. Yes, it's a skill. You need to learn it to be able to put somebody in a situation whereby the person can breathe, even when if the person slips out of consciousness, the person is still able to breathe. There's no blockage in the airway. Okay. So it's important that we do not provide anything orally in an emergency, especially giving water. Please be very, very wary of that. So we have learned the 3 P's of first aid. The 3 P's of first aid. Okay, so now go to how do you manage incidents? How do you manage incidents as a first aider. Now, like we mentioned in Doctors ABC, always conduct a risk assessment before rushing into situation. Whatever the situation may be, check for danger. Look for any potential hazards to yourself, bystanders, or the patient, e.g., moving traffic, fire and smoke, electricity. Never put yourself or other bystanders in danger. So I'll give an instance. This happened somewhere in Surulere, Lagos. Okay, so there were this set of twins, pretty girls, who were screaming for help. It was they were having what happened? There was this cable that fell on their roof around the shop area, and then they were getting electrocuted. So they were screaming for help. And then a medical doctor who overheard them, heard their shout for help, came, tried to open the gate to approach them. And in the process of doing that, he got electrocuted and then he fell to the ground. Eventually, the girls too got unconscious. When extra help came, like they had to call the electricity company and all that, and they turned off the area. The girls were revived. They were able to rescue the girls, but the man had a cardiac arrest and died. Now, the man meant well by going in to try and rescue the girls. However, he did not assess his situation properly. And again, being a medical doctor, it is not just one person who has just lost his life. Because right now in Nigeria, we have a doctor says like 1,000 people now. So 1,001 persons have lost their lives by that incident. So it's important that as a first aider, always assess the situation before you go in. Okay, remember, you are the most important person. Sometimes your rescue might just be a phone call. Because at the end of the day, those girls were rescued. Yeah, they were rescued. So the person who was able to finalize or complete the rescue was that person who called the electricity company to turn off the lights. But the man who was going in to physically rescue without assessing the situation lost his life. I'll give another instance. A man saw an accident on the road. It was a lonely road, and a lady was on the, in line in the pool of her blood. The man did what he could do and carried the lady to the hospital. So during the course of inquiry and all that, the nurses asked, how did this happen? How did this happen? What happened? The lady had recovered her consciousness. And then the next thing she said, is that man, Naim, that man, Naim hit me. She spoke in pidgin. And then the next thing, it became a problem. So when the police were invited, they asked the man, do you have the certificate or a license to practice first aid? No. Okay. When the situation happened, who did you call? Nobody. Okay, who else saw the situation that, oh, this was an accident, you were only passing by and then you came to rescue? Nobody. So it was a very dicey situation. The man was roped into a thing that he didn't know anything about. However, after much, imploring, talking, they spoke, they had to cancel the casualty and all that. She now later owned up that, oh, sorry, I was afraid I don't have money. I was afraid that I will be abandoned. I just needed somebody to help fit my bill. He's not the one. So you imagine, always assess your environment before you proceed. Then one last example is there are times some casualties pretend and they may not be acting alone. So you probably see an accident scene, somebody is like lying upside down in a very, critical situation, and then you rush in. It might be an ambush. We have had or heard of such situation that a rescuer was ambushed and robbed in a lonely road. So let's always assess situations. You might see such a situation, the best intervention might just to call and be maybe wait around, but you don't have to approach directly. Okay. Now, let's go to common injuries. We'll quickly run through this. Before then, I'll do a quick recap on what we have learned so far. Okay. What is first aid? Doctors ABC. Roles and responsibilities of the first aider. The aims of first aid. Incidents management. Common injuries. So we are currently at common injuries. So we'll be looking at cuts and bruises, sprain and strain, electric shock, fire and burns, fainting, unconsciousness, shock, choking in adults and adolescents and children, as well as in babies. So those are the common injuries. We may not cover all of them because of time, but we'll try and cover as much as possible. So we did this exercise. I hope you've been able to send me your responses. I asked, how would you manage this incident? This is the incident. Two cars at a junction, one is ahead, one is at the back. How would you manage this incident? What injuries will the casualties present or could be present? What should your first action be? What should your first action be? Okay, cuts, common injuries, cuts and bruises. Okay, abrasion. Abrasion is also known as bruise or surface wound. So these are the cuts that happens at the top layer of the skin. It only affects this surface of the skin and then the tiny capillaries on the skin. So sometimes it might not bleed blood. It might just be bloodshot. It will just be darker around that area. Sometimes it might just be fluid, body fluid that will come out. So when you run it underwater, you have that peppery feel. Oh, like there's an injury there, but it's not very visible. And the blood that came out is not visible to the eye. So you might just see only water. So that is an abrasion, bruise or surface wound. So how do you take care of that? You just take your cotton and then you use your Sablon or Dettol. It can be it can be any other brand, but I'm just using that name because that is what we are more conversant with. So you dilute it. So it's more like 1 part of disinfectant to 3 parts of water. So you don't use it concentrated because it can inflame, burn the skin. So you use it to clean the area, not directly on the wound. Clean the area, the dirt around the area. Then you can use your tweezers. I need to bring out tweezers. In case there are debris, you use your tweezers to remove the debris. And then you use your gauze. Okay, you clean the wound, the surface of the wound with gauze. So the okay, the protocol for cleaning now no longer accepts the use of cotton wool for surface of wounds because cotton wool can leave behind debris like strands. And if you see chickens, sometimes they will have these hair strands around their leg. After some time, what happens? That part of the leg gets amputated. So similarly, when these strands get into injuries, they get infected. And after some time, the injury gets deeper and deeper. So instead of getting better, you see the injury getting deeper and deeper, and you'll be wondering, oh, what's going on? So the protocol for wound care no longer accepts cutting on the surface of wounds. You either use cleansing wipes or you use gauze. Okay, sterilized gauze. So I'm sure you must have seen in hospitals, when you go to hospitals, you see nurses, they will fold. You see them fold, then they cut. Fold. So you see square gauzes like this, and then they keep them inside a container that has spirit to sterilize them. So they do that. They have this cut gauze ready to use in case of wound dressing. So you take and wipe the surface. This is a cleaning wipe. Wipe the surface of the injury. Okay. So this is the gauze. I'll be using this later because it's a bruise. There's really no need to cover it. It's a small injury. Just need to aerate and then to dry up and heal. But I'll be using that gauze later for other demonstrations. Now, laceration. So laceration occurs when a sharp object cuts through the skin into the flesh. Okay? So it can be as a result of a knife cut or barbed wire. So a sharp object cutting through the skin into the flesh is a laceration. Now for lacerations, you clean the environment with the disinfectant as usual, and then you cover the surface. Should there be debris or anything, you use tweezer. Let me show you how a tweezer or what a tweezer looks like. Okay, so I'll get that. So you can use a tweezer, but should anything be stuck in it, like a big glass or something stuck in it, do not remove. Do not try to remove anything stuck in a wound. Okay, because that object might actually be preventing bleeding or somewhere from preventing that person from bleeding out. It might actually be blocking the blood vessels so the person does not bleed out. So what do? You reinforce. You reinforce with gauze. You reinforce with gauze. Okay, so you place gauze on both sides of the wound and then you bandage. Okay, so for a more in-depth, this is more like an introduction. So for more in-depth practical learning on first aid, such activities are done. So next we talk about incision, like cat mark, fingernails mark, or maybe a spike just cut the face. It might not just be the face, might be on the hand. So incision, they are like small lacerations, small lacerations. So for that one, similar care applies as the cleaning and the covering with a gauze. For avulsion, it's an injury that is caused by a sharp or a blunt object going into the body and then pulling out muscle. So it could be like when somebody falls into a gutter where an iron is sticking out and then the iron stuck into the leg or something. So in the process of coming out of the place, an avulsion happens. So the iron pulls out the muscle. Or maybe in an accident, there was a break and then a multiple injury, which resulted to fracture and cuts, and then the bone shoots out of the body. Okay, so for such, it causes excessive bleeding. Most injuries like that causes excessive bleeding. And when such happens, you have to control the bleeding. As long as the person is breathing, it's okay. Next thing is to control the bleeding. Then you dress. Because it will be wrong to start dressing when there's so much blood coming out, because the dressings will not stay. They all go bloody. Okay, so you control bleeding in two ways, whether by direct pressure over the surface of the wound or apply pressure at the pressure points. So we'll do a quick exercise. Now press your hand. If your hand does not go around your wrist completely, you can use a cloth. Tie it up and press it for like 30 seconds. Try and raise it up above your chest. Press it for like 30 seconds. Okay? Then release. How did it feel? After releasing, you feel this sudden rush. You feel the sudden warmth in your palm. So your pressure points are usually your joints. So should you have an injury at the back of a palm or in your palm that is bleeding excessively, your pressure point is the joint to that injury. So the wrist is a pressure point for the palm. For the lower limb, the pressure point for there is the elbow. Just take a cloth around the thigh and then hold it up above the chest. So for the upper arm, the pressure point is the armpit area. Okay, take a cloth and tie. So I'm sure in movies, when you watch some movies, you will see where the actor is shot in the leg or shot in the arm, and then the next thing he will tear his shirt, try and make a rope out of it, and then tie his leg and continue shooting. Why? Because he has arrested the bleeding, so he doesn't bleed out and die as a result of loss of blood. So there are two ways of controlling bleeding. It's either through direct pressure in the point of injury or through pressure points at the joint presiding the injury. Okay. Then we have a puncture wound and then amputation. Okay, I've spoken a little on puncture wound. Should there be any cuts or that has something stuck into the body, do not remove. Like when I mentioned tweezers, I was talking about debris, debris that are like on the surface and all you can just remove with tweezers or remove with running water. But anything stuck in the flesh, please do not remove, because it might be preventing that person from bleeding out. So for amputation, should any part of the body be cut off, it's expected that you keep in a Ziploc bag. Look for it, keep in a Ziploc bag. Do not apply on ice directly. Please mute. Please mute. I will appreciate if you mute. Anytime you're in our class, always mute, please. So do not put the cut body directly on ice, or you put ice directly on it. No. Create a cold environment. So usually for moving body parts or organic part of the body, you can use a specimen container, or what's this thing called again? ice pack. So you create a cold environment. So you probably put your ice, maybe the ice in sachet water and all that, put it in a container, and then you put the part of the body in a Ziploc bag in the middle. Do not allow ice to directly fall on it or to be placed on it, because ice will make all the cells, the body cells, lose its essence. Like it will kill the body cells. Like when you hold ice for too long, after some time, what happens? Your hand goes numb. Okay. So if it continues like that, some people have gotten their arms or legs amputated due to frostbite. So when frostbite happens in a body part, sometimes in very severe cases, the hand or the part of the body loses all its senses, its nerves, the cells are dead, and then they need to amputate. So do not place ice directly on the body part, so they can still see the nerves and the blood vessels and reattach should the need, or should the doctor be skilled to be able to do that. Next is spring and strain. So who can tell me, put direct pressure. There are two ways of controlling bleeding. Either you put direct pressure on the wound or through pressure points. Okay, so who can tell me the difference between sprain and strain? So put your answer in the chat. I'll give you a minute to look at it and then give me your answer. What is the difference between sprain and strain? Just a minute, put your answer in the chat. Okay. Strangler. Okay, do we have answers? No answers yet. It's already a minute. No answers yet. Okay. Somebody has dropped an answer. Let's see. Okay, spring. Okay, sprain affects the bone. Strain affects the muscle. Fantastic. I love that answer. Yes, you're very correct. Sprain affects joints. Okay, so as I say, oh, I sprained my knee, I sprained my ankle, I sprained my elbow, I sprained my shoulder. So it affects mainly joints. While strain affects mainly the muscle. Oh, I have a strained calf. I have a strained thigh. I have an hamstring strain. Yeah, especially for sports people, very common with people who are engaged in active sports, or people who are not active in sports, but when they stress themselves, their muscles react because they are not used to, the stretch or the stress. Okay, so sprain, any injury that occurs in the joints or in the muscle, you apply rice. We eat rice every day. So you can use that. Oh, I eat rice every day. Should you see somebody who needs your skill, remember rice. So what is rice? Number one, rest that leg, rest that hand. What does it mean to rest the leg? It means that that leg should not, no pressure should be applied on that leg or that hand. So like we have in the picture now, the person is resting the leg by using clutches. So you may not have clutches, or is it crutches? Sorry. You may not have crutches. So what do? You, the rescuer, will now stand on the side where the leg is injured, and then you will now be the second leg for that person. So you tell the person, move that leg, then you move the leg, you move the leg, you move, until you get to a place where the person will sit. So ensure the person rests that leg. No pressure should be placed on that leg. Okay. The next is to apply ice. Now, do not apply ice directly on the body. It is very dangerous. It can cause the cells around the body to die. It can kill the cells of the body. So instead, wrap the ice in a cloth. So even if it is a sachet of water that got frozen, still wrap it in a napkin and then you apply it on the body. Try to move it around the area. Don't just fix it in one place. Okay, try to be moving it around. Okay, then the next thing is to compress. So when we talk about compression, you use your compression bandage. So this is an example of a compression bandage. So some also call it crepe bandage. So the size of your compression bandage is determined by the area of injury. For this size is for the lower area. So if it were to be for the leg, it's usually a bigger, especially the upper part of the leg, it's usually a bigger size compression bandage. So you can easily wrap it around and then to cover a good area around the bigger part. So different, when you go to buy, usually the pharmacist will ask, okay, what part of the body is it? And then you'll be advised. Then next thing is to elevate. So you try to raise the leg above the chest area. Why? So that there is no accumulation of blood. Because when blood accumulates there, it will swell and to go dark. So it's like there's collection of blood there that is like looking for an outlet. So you try to raise it above your chest area so blood can go back and circulate to the other parts of the body. Because when the leg is inflamed, it's very vulnerable. Capillaries are broken, and sometimes, if care is not taken, the entire bruised or sprained area is will go dark. We'll have a collection of clots and go dark. Okay, so in those days, our parents in those days, as soon as you present with a sprain or strain, next thing is to boil hot water and then get hot balm. I remember Chinese balm in those days. They will use it and massage and massage and massage. So please, let's not make that mistake. We are better informed now and we are better equipped with the right information on what to do in this situation. Now, a sprain and a strain causes inflammation around the area of injury. So within 48 hours, do not apply anything hot. Because within those 48 hours, the inflammation is trying to, the inflamed area, you try to allow the inflamed area to recover. So that's why it's expected you use ice, compression, and elevation to do that, achieve that recovery. Then after 48 hours, you can then massage with hot water, balm, whatever the need may be. However, for the first 48 hours, it's expected you do not use hot things to worsen the inflammation. Okay? I mean hot water. Do not use hot water to worsen the inflammation. Electrical shock, especially in the household. Okay, so okay. Electrical shock, especially in the household. Yeah, I'll do, Mr. Chooks, I'll do a recap. Let's try and conclude on the injuries as much as possible. I'll do a recap, definitely. And then you can also go on YouTube to refresh your memory on everything that we are talking about. Okay, so electrical shock. So what happens? How do you provide skill help should an electrical shock happen in the house? Let's apply our doctors ABC. Number one, watch for danger. Now, how many of us know where our junction boxes are? The main switch over. That should be your first point of call in an electrical shock, not the switch, not the dry stick, not the mat. Your first point of call should be go to the main switch and put on neutral. Don't put on generator area because it might be as though, oh, okay, I was charging and my phone is just 2%. The person who is in the other room or in the other flat might not know that, okay, you are trying to do a rescue. And then the next thing goes to on generator because you have already put it on generator. Okay, so it's important that when you see an electrical incident, you announce it. There's an incident, there's an electrical incident, I'm turning off the power. You try and announce it so as many people that can hear will be aware. Okay, so if it's in an office, you quickly call a muster. You tell everybody to move to the muster point. You call out there's an emergency and tell everybody to move out to the muster point because you don't know where else might be affected. So everybody move, follow the emergency protocol and move to the muster point. Now, go to the switch, put on neutral immediately. Put on neutral. And then you go back to that person with a dry stick and a rug to hit the person's hand off wherever the electrocution point is, and then gradually drag away from that point. Gradually drag away from that point. Now, going to switch off is a very wrong idea because in the process of going, you have experienced it in the past, that switch that you didn't even go near, but because you entered the electrical radius, it will pull you. So it is wrong to now start looking for where the switch is on the wall to go and turn off because you might enter the electrical field and then you get pulled into the field and you get electrocuted as well. So go to the main switch. Thereafter, you provide your rescue. Okay? Fire or burns. So for fire, should anybody present and you see the person on fire, immediately call out to the person. Don't tell the person come. Don't tell the person go. Just call out to the person. Stop, drop, roll. So we usually tell teachers to use this as a song for their students. So clap, stop, drop, roll. Stop, drop, roll. Stop, drop, roll. So immediately you see somebody on fire, tell the person to stop, tell the person to drop, and tell the person to roll. So when someone is on fire and you are running, the atmosphere contains oxygen. Oxygen will feed the fire and the fire will keep burning. So it is advisable not to feed fire. Instead, use a blanket to quench the fire. So should there not be a blanket and maybe the person is far away from you, instead of telling the person to come and meet you or you running to come and meet the person, thereby losing time, like we said, time is life, you tell the person to stop and drop. So dropping to the ground, you have the sand on the ground. and the sand on the ground will act as a blanket. And as the person rolls, the body of the person will also serve as a pressure to quench the fire. So as the person rolls, drops to the ground and rolls, body serves to quench the fire. So that is why in every facility it's expected that aside from having your fire extinguisher, you also have a fire bucket, a bucket that contains dry sand. Because sand serves as um, what can help to stop fire from burning, serves as a blanket, a cover to stop fire from burning. Okay. So now, when a burn casualty presents, it's expected you cover that person, especially when the person is in shock. You cover that person. Now, do not use a cloth to cover that person. We have what we call fire blankets. It's like a foil paper. Okay. That's why if you buy fish in good restaurants, you see that they don't wrap the fish with paper. Why? Because that paper will eat into the food. What do they wrap with? They wrap with foil. So similarly, burnt skin, you cannot use a cloth with fiber. Why? Because the fiber would stick to that skin and then it will take another effort to now start removing that skin and can cause further injury. Now, in a fire, after the fire is quenched, try to place that injured part under running water for about 5 minutes. Let it keep running. Keep running cool water on it for about 5 minutes. Please, 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 do not put egg, salt, what else do they put? Sugar, flour, cornstarch, whatever. The thing that is needed for that injury is cool running water. Don't go and look for ice. You said cool running water. It should be room temperature. Okay, cool running water. Run it over that place, and then should there be blisters, don't burst it. Leave it, and then let the person stay in shock position. So this is actually shock position when the person is laid on the back and then the legs are raised above the chest area. Okay, so this helps people who have experienced very traumatizing situations, things that have taken them by surprise. This position helps them to recover quickly. At times when somebody is in shock, you see the person shivering. The person is not cold. The person is in shock position. Is in shock. The system is like shaken. So in such a situation, no water should be given to the casualty. Instead, put the person in shock position. Okay. Okay, so next we'll be looking at fainting unconsciousness. These are similar. These are similar. Okay, so when you talk about fainting and unconsciousness, they are similar. However, I'll let you know the difference between the two of them. Okay, so for fainting, it's usually a short spell. A short spell. Like people who have been pregnant or who are sick, you just have a slight dizziness and then you're able to recover within seconds. While unconsciousness, people just lose their selves. They lose consciousness of themselves, and for like 5 minutes, 5 minutes, they are out of themselves. Okay, so fainting is usually a short spell, a few seconds to recover yourself. Most times, people who faint don't fall. just go slump like that most times, but there are a few cases where they faint and then they are like still awake. Okay, while an unconscious person goes unconscious, and then can stay for a couple of minutes before they recover. They will be breathing fine. They might look pale. They might go into shock, but they are responsive, which means they can still breathe on their own without assistance. Okay, so in a situation whereby you see a casualty who fainted or is unconscious, the next thing is to check if the person is breathing. Once the person is breathing, you lay the person on the back, try and elevate the legs to restore blood flow to the brain. Because such times, maybe the brain is short of oxygen. So you try and elevate the legs so blood can quickly move towards the brain and then oxygenate it. Now, like I mentioned earlier, when you're attending to casualty, do not remove. Instead, you loosen, loosen. Have the belt. So the airway area, you loosen. Maybe the last button is quite tight, or there's a tie, you loosen. The belt, you loosen. For the shoes, you might want to remove the shoes in case they are too tight. Otherwise, you let it be. Okay. Then next, to try to revive the person or try to let the person know, respond to you. Hello, how are you? My name is so so. Hello, how are you? My name is, what's your name? Do you have anybody around I can call? And then if the person is not responding, immediately call an ambulance, call for help. Do not act in isolation. Do not walk alone in an area where you don't have people. So immediately call out for help. Hello, help, somebody help me, somebody call an ambulance. And then after you have announced that there is no feedback, then you can take your own phone and call emergency service. We do have some emergency services that are functional. However, when you deploy those emergency service, you will need to be responsible for their logistics because there's a fee attached to it. So when you call 999 in Nigeria or 797 or 112, by the time they deploy an ambulance, whoever deployed or requested for it will be paying for it. So that's why a number of people shy away from making those requests. Okay, so like I mentioned, for fainting and unconsciousness, the person is definitely breathing. So in such situations, it's expected that you do not start pouring water on the person or start sprinkling water on the person. It can cause shock. Like for instance, you are going into a shower and you are pouring water on your head, especially when you pour water for the first time. You have that shock experience. So do not pour water on a casualty. It is wrong. Then the next thing you should not do in this situation is to start slapping the person. Oh, the person fainted. Let me slap the person back to consciousness. No, it doesn't work that way. So just putting the person in a shock position or putting the person in a recovery position works just fine as long as the person is breathing. Okay? And then never leave a casualty alone because anything can happen. Sometimes you need to be available, you need to be on ground to keep reassuring the person, keep talking to the person, do not leave that person alone. Okay? Shock. So we've spoken about shock, how you should place somebody in a shock position. So this is it again. And then most times when you lay a casualty on the back, try to turn the head to the side. Reason being that when you turn the head up, the tendency of having a collapsed tongue blocking the airway is very high. So when the tongue, because there's just a small muscle holding the tongue, and when the tongue is relaxed, especially in the situation whereby the person is in a state of shock, the body is not really responding to normal expected outcome. So what you do is to turn the person's head to the side. So it kind of locks the tongue away from blocking the airway. So that's the mistake a number of people make when carrying casualty to the hospital. They leave the casualty face up, and then because the casualty is weak, he is not able to control his muscles at will. The muscle of the tongue collapses, and then the tongue falls back and blocks the airway. I'm sure some of us have experienced this maybe at night when you're sleeping, and then because of sleep, you just notice it's like somebody is pressing your neck, and then you wake up and start kabashing. Actually, the tongue that fell back and then blocked the airway. Or sometimes when you're sleeping, there's a collection of saliva, a collection of fluid. And then because you are sleeping this way, after some time, the tongue will relax. It's no longer able to block the saliva from going down. And because it's not guided, like when you are eating, you're able to guide the food to enter into the trachea and not the airway because you are sharing space. It now, some of it probably goes towards the airway and then it makes you cough, gives you this coughing spell in the middle of the night. It's like somebody's trying to force food down your throat in the sleep. Somebody's trying to feed you at night. No, ma. It is the tongue that collapsed, and then saliva now went towards your airway. Okay, so acting from this point of understanding gives you a better understanding of how you sleep, and then you are able to position yourself in a way that your tongue does not collapse anymore to block the airways. Okay, so let's go to choking. Now, this is a very important part of our training, and it's something that I'll need you to pay close attention to because it can save lives. Okay, so for adolescents and adults, this is the way to rescue or provide first aid in a choking situation. But first, how do you know someone is choking? Now, should someone come and meet you and it's like, something, it's like there's something, I'm trying to cough, and you see the person making gestures towards the neck and chest, you know that that person is having partial choke. Why? Because the person is still able to talk. So there's still airway for the person to breathe and talk. Okay, in such a situation, you tell the person to cough repeatedly, cough from the bottom of his stomach, cough with his toes raised, okay, cough with his strength so that whatever is blocking the passage partially can be pushed out. Now, should that not work, and then the person after some time is no longer talking, instead the person is just making gestures, and then it's like he's having showing so much tension, and they're probably hitting his fist on the chair or table or stamping his feet. He's no longer able to say anything, and he's like trying to say something but nothing is coming out. That is full choke, full choking, which means the entire airway is blocked. And in such a situation, you turn the person's back. Please, I'll explain and then I'll ask my students to come. Okay, so you turn the person's back and then you give, okay, let me use my mannequin. You turn the person's back, bend the back a bit, tilt it a bit, and then cup your hand. So there should be this hollow in your hand. Can you see that? Your hand should be a bit hollow at the middle. Cup your hand, and then at the middle of the shoulder, at the middle of the two shoulders, put your hand there and give 5 blows. 1, 2, 3, 4, 5. And then you take a break. Okay? And if that does not work, then we do what we call Heimlich maneuver. Heimlich maneuver. So Heimlich maneuver is also called chest thrust or stomach thrust. So there's a difference between the chest thrust and the stomach thrust. You can use either of the two. However, for pregnant women, it's advisable you use chest thrusts. For people with enlarged abdomen or stomach that your hand cannot go around, it's advisable you do chest thrusts. So you do 5 chest thrusts, then 5 back blows simultaneously. You do 5 chest thrusts or stomach thrusts, and then 5 blows until the blockage is out. Now, what you should not do in a choking situation is to dip your fingers into the person's throat and be fishing for what is not there. Do not. You can do a swipe of the mouth. Maybe there's saliva there, or you just want to get a clearing. Maybe some things came out and then you just clear it. But don't go digging into the throat. It's wrong, because in the process of doing that, you get the person injured and things can go wrong, very wrong. Okay. Okay, so we'll practicalize that. So let's first go and then learn about how we can rescue or provide help to children who are choking. Okay. Now for children, it's similar. The process is similar. You tell the child to cough, then you give 5 blows in between the shoulders at the back with your cupped hand. The difference there is that for the thrust, for adult men and women and adolescents, you fist your hand to give the thrust. But for children, you open your palm to give the thrust. Don't fist for children. For Heimlich maneuver in children, you open to give thrust. For adults and adolescents, you fist to give thrust. So your inactive hand is fisted, and then your active hand is on it, and then your active hand pushes up on the casualty. So we'll practicalize that. We'll need to readjust the camera to be able to capture it. Okay. Now, when you are providing Heimlich maneuver or even any form of intervention for children, always come down to the child's level. Do not walk over or towering over a child as your casualty. So even if your casualty is a dwarf, you need to come down to that person's level. At least when you walk on your knees. Okay? Don't tower over. So for babies, this is very technical, and I'm going to explain it as easily as you can understand. Okay? So when you see, because babies can't talk, they can only cry or laugh or become unresponsive. So how do you know when a baby is choking? You see that the baby having trouble breathing. You see that whatever you are doing, the baby cannot cry. The baby cannot make sound. A baby that is usually very bubbly, any little thing, maybe when you are playing with the baby is doing or no sound. The baby is just looking. And after some time, the baby is turning blue. Choke. Just know that the baby is choking. Okay? So in such a situation, you quickly take the child, tilt the child's head, put it at an angle about 15 degrees away from you. Now, when you are holding the head, do not hold the neck. Look carefully. I'm holding the jaw, and then my fingers are on the shoulder. I'm not holding the neck. So I'm holding the jaw cheek together and the shoulder. Then I am tilting some angles away from me. Okay, tilting some angles away from me. And then with the heel of my palm, okay, the heel of my palm, I'll give 5 blows in between the shoulder blades. Okay, 5 blows. 1, 2, 3, 4, 5. Immediately I turn, and then I give 5 thrusts in between the nipple. So remember, do not hold the neck. So you can see now, I'm creating like a cup around the shoulder and then the head. So I tilt a little, use my 2 fingers in between the baby sternum is quite light, so it's still small. So in between the 2 nipples, I press 5 times. 1, 2, 3, 4, 5. So I alternate that back blows and thrusts, chest thrusts, until the baby recovers. And should the baby in the process lose consciousness, you immediately put on a flat surface and begin CPR. Okay? So that's how to handle choking in infants. Okay, so similarly for babies, do not try to start dipping or digging down into their throats. No, you can take a flannel and then wipe excess food away from the mouth. Just wipe away. Do not dig into the throat. It can cause injury. It can further push the object of blockage further into the airway. So do not push your fingers to the throat. Okay? Are we enjoying the class? Thumbs up for yourself for paying attention and then learning so far. Okay? Okay, so we are almost concluding. So as a rescuer, what should you do when you need to make a call? It's important to understand how to make a call. You don't become an alarmist and then start raising panic. Hello, hey, blood everywhere, head everywhere, leg everywhere. Hey, people have died, oh no. So as a first aider who has learned so far, you need to be able to give clear, precise information about the exact location of the incident and any access problem. Oh, this is the location. It is at so, number so, opposite so. There's a so landmark. Okay, let me use my office now. Oh, a house 2 road 4, Abraham Adesoya Estate. The estate is beside Abraham Adesoya Junction traffic light. It is off Ogombo Road. Okay, so the estate, the landmark around the estate is one chicken hut. And then the landmark around the facility is the pet haven. So the pet haven is a very popular place where people come bring their pets and all that. So I explained that to the responder. So the next thing is, how many casualties? Oh, only 2 casualties. And then the nature of their injuries. Okay, one has blood flowing from his head. Then the other person, I cannot see any visible injury. However, the person is lying unconscious. But I have checked his breathing. Okay, fantastic. We are giving them something to work with. Maybe when they are not coming, they'll probably come with an oxygen tank or a spinal collar. Maybe there is a neck injury, so they will know what to bring when they are coming. And then you try to give an estimate of the person's age. One is around, by what I'm saying, one is around maybe in the 30s. The other one is a middle-aged man around 50. He has gray hair, plenty gray hair. So it's around 50, 60. Okay, and he has pot belly, so it's around 50-60. So you also ask any hazards at the incident. Is it like a car? Is there fuel there? Can you smell fuel? Was it an electrical accident? You say, no, it's roof that fell. But the roof fell where there is petrol. They keep petrol by the generator house. The generator, so you try and explain what you can see. Please do not exaggerate. Do not exaggerate to make it sound like a sensation. Give what you see. And then if you don't see it, say you don't see it. And then try and see, check around for more information that will be helpful to them. And then if the area is remote, roads are not very okay, mention it. Then you wait. Do not just provide that information and run away. You wait in order to assist them. If you are not able to wait, try and assign somebody to be able to wait, who will also meet them or be able to direct them should they miss their way. Okay? So in conclusion, hey, and so many of you are already very happy. Oh, finally, you are at the end of the talk. So in conclusion, from minor cuts and burns to heart attacks, strokes, this information is handy. What do I mean by this information? Your manual, because it's not everything you can remember. So you need a first aid box like this in your home, in your office, in your school. And then the first aid box must come with a manual. And the manual must have all the guides for all injuries. So you can easily reference should an emergency come up and you are lost for what to do. So you can easily reference the information there. So be prepared for any medical emergency. Handle it safely and efficiently with the complete first aid pocket guide. Then quickly identify signs and symptoms of a wide range of medical conditions and learn how to recognize the difference between a minor injury or illness and those that are more serious with this essential handbook. So it's important you have a manual that you can always refer to in an emergency. The manual will also guide you on, because some first aid boxes come stocked. Some first aid boxes come stocked. Some do not have, some are just empty boxes. So you need to fill them in. So these are basic things for first aid box. And then always remember your emergency contact number. For Lagos, 767. 999 is the national number. 112 is the national number. 122, that's for safety. So it's also a national number. So have this in your first aid box. Have this in your first aid box. Okay? Now, it's expected that you don't keep medications in your first aid box. What you need are things to take care of cuts, injuries, and the likes. Medications should be kept in a medication shelf. Okay? And each medication should have your doctor's prescription. Do not keep medications without doctor's prescription. This is an advice I give schools when we train schools on first aid. Okay, so when government officials come on inspections, they don't expect to see anything medication, not even paracetamol or syrup or even what's it called, vitamin C in your first aid box. It's not a first aid material. So these are the basic things needed to be seen. Then you can create your shelf for your medication. And should it be a health facility, anything outside of these can then be in your crash cart. Okay? So we'll go back to that same exercise, and then I'm sure with what you have learned, you can now answer your question better. Okay? So let's see. Now, potential hazard in the situation: moving vehicles colliding, oil or fuel spillage, which means there can be the risk of explosion, broken glasses, so you have cuts and bruises that can happen there, deployed airbag, so that can give you chest injury because of the impact on the face and chest. Then the risk of fire, like I mentioned, risk of fire or explosion. So potential injuries there are cuts, bruises, fracture, dislocation, burns, sprain, strain, and shock. Okay, so I'm sure some of you got this, but I still want to see your answers. So quickly, we'll watch this video and then we call it a day. Okay, so someone complained that she wasn't hearing. Who else did not hear? Let me know.
I said I wasn't hearing
You're not
Napoleon.
hearing too. Okay.
Yeah, I didn't hear the last part. Thank you.
Okay. Let me work on that now. So it's actually a summary of first aid in 3 minutes. So this is actually to help encourage confidence, to boost your confidence, to be able to apply knowledge, and then to stay calm in situations where you find when you find emergencies, that emergencies can be handled and it's not going to take any life. So take charge, take control.
If that doesn't work, up to 5 I've got like this. Press up and down on the text like this. You can aim these about if somebody is unconscious of breathing, can't answer basic context. Repeat until successful. Those to collapse on the floor and not breathing, then start CPR. If somebody has burned themselves, remove any jewellery. Cool with running water for 20 minutes and rest with clean film. For somebody who's bleeding and high pressure, preferably with a clean bandage. Do not place any embedded objects. Pack around the objects involved in bandage like this. Any of these people pick up shock. So they might feel sick, they may look pale, clammy. Get them to lie down on the floor, raise their legs, reassure them, and continue to walk. Pain, deformity, and swelling could be a strain or a brain. Get them to rest the injury, apply ice, and elevate the focus. Cold, itching, swelling. If somebody has got central chest pain and feels unwell, you need to call an ambulance, make them comfortable, and assess their pain. Reassuring and encouraging to sit in a tripod position. If they suffer with anaphylaxis, which represents swelling, difficulty breathing and a rash, and you get them to take their air. If someone has had a seizure, they clean the area, place something soft under their head, and don't strain them. Call 999 if it's not normal for them. Place in a neutral position if they become unconscious. For someone with a drooping face, slurred speech, and a weak arm, they could be having a stroke. Call 999 straight away. The quicker you are, the more the person you save. If somebody is too cold, warm them up. Body heat is best. If they are too hot, cool them down with fan, water, and medication. Now, this is a first aid. You'll find one in your workplace. Look inside one and know what to expect in an emergency. So remember, be assertive, keep it simple, and protect yourself first. Simple action, save lives. And that was the 3-day birthday for in 3 minutes.
Okay. So thank you very much. You have questions? Let's have them.
that's very important in between.
Questions? Okay, so I said I was going to show you the Heimlich maneuver. So I'll quickly do that. I'll have your favorite nurse in the house, Nurse Benedicta, to support me in doing that. So. Heimlich maneuver. Yes, sir. No, you sure? Okay, so for Heimlich maneuver, let me back a bit. Okay. So for Heimlich maneuver, after asking the casualty to cough, you put your hand just below, where your with one finger, where your stomach is. It's just below your diaphragm, close to your rib cage, where that area where your ribs meet. That's the area where your stomach is, and then this is the size of your stomach. This is the size of your stomach. So a lot of us eat, and then enlarge it to this size because of food. So you place your hand just around the stomach area, tilt the back, and then you give your cupped hand 5 blows. 1, 2, 3, 4, 5. So for you to feel how it's supposed to be, so when you're administering it, Miss Madam Benedict, I'll give you only 1. Okay? So it gives that hollow feel, right? So that's how it's supposed to. So it's more like drum. You're trying to like dislodge something from the food canal. Okay, so now we have the chest thrust, then we have the stomach thrust. So for women, generally, it's advisable you do the chest thrust because you might not know who is pregnant. So you fist your hand, this is your inactive hand, then your active hand above it. Stand properly, and then you thrust upwards. So that's actually the feel. So the idea is to be able to push up pressure, and then whatever is in the airway or the canal area causing blockage can be pushed out. Okay, so I'm sure she felt it, and then she said, okay, so you keep doing that until the passage is free. Okay, you don't stop, except maybe the person goes unconscious, and once the person is unconscious, the muscles are relaxed, there's no more constricted, there's no more pressure around the food, that food will drop. So what you now do next, if the person is breathing, put in recovery position. If the person is not breathing, what do you do? CPR, correct. Okay, so now the difference between adult and adolescent Heimlich maneuver and children Heimlich maneuver, like I said, is the placement of the hand. So for children, you don't fist. You open your hand, put the other hand above, and then thrust, okay? For adults, you fist. For children, you have your hand open. So thank you very much. You've been a wonderful audience. See you for the other classes. It's a series, like I said, we still have 3 other topics that we are going to cover, and it will finally end. The free training series will finally end on Thursday. Yes, to finally end on Thursday. And thereafter, we'll have the assessment. You do your assessment, and then you're expected to score at least 50% of the questions, and then you're eligible to have your certificate. Like I mentioned, you pay a token for that certificate, which is just 5,000 naira. So take care of yourself. Remember to do your exercises, and then send to 0911-831-4047. Send your responses to 0911-831-4047. So I didn't get your question. Are we still going visual? Okay.
I'm just asking if we're still going to do
Because
more
of a
visual.
request, all the classes are going to be on both on-site, in class, and then virtual. So yes,
Okay.
we'll be having
Leave
them
virtual.
both in class and virtual.
I will just be joining because I'm not in town.
Okay. So it's both in class and virtual. Yes, and then you can refresh your memory, go back to learn everything we have learned so far on our YouTube channel. It's on infomoricalhealthcare@gmail.com. So we'll share that link to everyone.
Please share it so that I can go back and listen because I'm missing some things when my granddaughter was stressing me.
Okay. No, she was catching your attention. I know they're on holiday.
No.
Okay, so have that, watch it. We are currently live, so you can get to watch it on our YouTube channel. So you have the time to go through it stage by stage, injury by injury, intervention by intervention. So you have any questions, feel free to send your messages on 0911 831 4047. Your exercise response, please do not forget, send it to 0911 831 4047. You've been a wonderful audience. See you tomorrow in class. Bye.
Thank you so much. We appreciate you.